On the air with us is Robyn Tannehill, the mayor of Oxford. Good morning, ma'am. How are you?
Good morning. How are you?
Too many moving parts this morning, but we'll catch up about the time the show's over.
There you go. That's always the goal, right?
Yeah, sounds like mayor, doesn't it?
It does. Sounds a lot like being the mayor. You know, I have thought several times recently. I ran unopposed, and now I know why I was the only one that wanted this job.
You know, I from governor on to supervisor, mayor, whatever it happens to be, for you folks who are deciding to get into politics, this is part of it.
It is part of it, Paul, and honestly, I'm honored to be able to serve in a time like this. There's nowhere else I'd rather be than Oxford, Mississippi.
Mm-hmm. So the restaurants on the square, the restaurants everywhere else in the city and around the area are going to be open today?
They are not. Our board has been very cautious, and I think rightly so. You know, I think we have operated under the understanding that if we overreact or do too much, we'll likely never know, but if we do too little, it will certainly be obvious. And our board is going to meet on Saturday at 11 to determine when restaurants will open, and I suspect they will open on Monday. But, you know, it's a board that votes, so we will have to wait and see. You know, seeing the large number of spikes in the state this past week, our board was just a little hesitant. We have been very strict in Oxford, and I think that you can see in our numbers that has fared well for our community.
Well,
and that's just kind of the approach we've taken. I'm not sure there's right or wrong anymore in the way we approach things. We're all just trying to use common sense and compassion and make the best decisions we can with the data in front of us.
Just wondering the difference between a Thursday and a Monday. It's only a few days and a weekend where you have Mother's Day.
Right.
Why is that big of a difference?
Well, I wish that I could give you a great answer on that, Paul. I think my board was just on Tuesday night. We had our regular meeting and discussed whether or not we would allow restaurants to open on Thursday. Of course, the governor has been very generous in letting municipalities determine what their specific requirements would be, as long as they were more stringent and not less stringent than the ones that he's put in place for the state. And our board knew that after opening our retail businesses a week ago, that they just wanted to see a full week and a little more of data coming in to see what effect that was having.
So if that data is equally as daunting as it was this week or tomorrow, they may not open on Monday.
Well, certainly that would be their prerogative. I don't believe that the data in Lafayette County will support waiting to open.
I was reading a little bit earlier what our friends over at Georgia Blue, I mean, they've done everything from a higher registered nurse to one of the other things is developed a curbside reservation system.
Oh, wow.
So that the guests may wait in their vehicles until the table is ready, thereby eliminating crowded wedding stations, and they don't have to wait in line, any line, even if they're separated 6 feet apart. So our restaurant folks out there are getting very, very creative. But and I mentioned this earlier, why didn't we do this early on? Go to each individual type of business and say, hey, have you got some ideas? And I don't think we did that.
Well, we probably didn't do it on the large scale we needed to. We have certainly been in touch with our local businesses to have those discussions, and the truth is most of our restaurants that I've spoken with are putting in much more stringent requirements than what we will require when they open. We have a Phase 1 plan called Serving Oxford Safely that our board has adopted that will go into place as soon as the board decides that restaurant dining rooms can open, and it tracks along with what the governor had in Executive Order 1478 and a few other things that are addressed. But most of the restaurateurs that I've heard from, just like you said about Georgia Blues, have implemented much more stringent requirements for their businesses than what we are requiring.
Yeah, and I said it earlier a couple of times when we were talking to Robert St. John. I think for people who are a little skittish about restaurants and you hear these horror stories on some of the bad ones, none in Mississippi, I think you're going to be safer with more cleanliness and checks and balances in restaurants now than probably the last 10 or 15 years.
I think that's a fair assessment. I do. We have required masks as well in Lafayette, in Oxford, and our the healthcare professionals here that we have spoken with say that is the best way to ensure success. I know the governor and Dr. Dobbs have both encouraged that in their press conferences. But, I think another thing that made our board hesitant is you can't wear a mask and eat. And so that will be one venue where you won't be able to wear a mask, and I think that was another thing that made them hesitant.
Well, I'll say this. We've never before had a sneeze clear out an entire restaurant, but this may happen.
It is a very unpopular thing, isn't it? Not get in the elevator and call.
That's it. I don't want to be standing by the door when somebody sneezes.
The look on everyone's face if someone sneezes.
Oh, man.
Holy moly.
I have to ask you, when you start looking at the numbers just past April and you start looking at them, and I know we heard some of the numbers as far as the state of Mississippi, but what do they look like in the city of Oxford?
Our numbers have been, we have had a few spikes, Paul, but really those spikes we believe are attributed to our long-term care facilities. Mm-hmm. And so we are trying to look at this as active cases. So although the data, I know that you understand, I heard you say it earlier this morning, it is from several days back.
Right.
Although we receive it on a certain day, it's not specifically related to the day before. And so we are trying to back out cases that are more than 14 days from the reporting date, knowing that those cases should, we're looking at 90-something cases this morning, but probably only, I believe our numbers yesterday, there were only about 6 active cases as we back out numbers from 14 days ago.
That's critical information for you to have, or anybody in a municipality to have, because I mean, and I was caught on this earlier this morning, when you start thinking about it, we hear, 32 more people died yesterday. No, they could have been in April.
That's right.
So,
that's right. And I think, not to throw stones at the folks who are providing the data.
I understand
how difficult it is to bring it in. But also, we get a report of how many people are hospitalized. Mm-hmm. And really, positive cases are critical for us to look at. But our healthcare facilities and their occupancy levels are more critical. The goal in flattening the curve is to make sure that your hospitals are available for every type of need, not just COVID-19. And so our hospital numbers show in the 30s now, but that I speak to our hospital administrator daily, and that number is much, much higher than what is actually in the hospital. Mm-hmm. So I think that as they collect the data, they are not collecting data on who is discharged. So I think there have been 31 total admitted to the hospital, but that's not how many are in there that day. But unless you know how many are in currently, the data is not that helpful.
The mayor of one of the greatest cities in the country, always in the top 10. And we have more small cities, and I say small cities in the state of Mississippi in that top 10 of retirement, a low crime rate. And we do an outstanding job from the coast all the way up to the Tennessee line on cities where people want to retire in our nation or in our state, and to be commended for that. Robyn Tannehill. Let me ask you about the other numbers. The numbers are within the confines of the board meeting themselves, and the revenue numbers as far as April's concerned.
Yeah, our revenue numbers are not looking great, Paul, but we are a community who thrives on sales tax revenues. More than a third of our budget comes from sales tax revenues, and we project that between now and the end of September, the end of our fiscal year, that we will be down about $2 million in sales tax revenues and another $1 million in everything from all of the fees that we get from our park commission, from our M-Trade Park events, from court fines, building permits, those kinds of things. So, unfortunately, we have had to make some decisions over the past month that I would have never dreamed we would even be considering. From furloughing employees, obviously, was gut-wrenching. And, we've had to discontinue some city services, our curbside recycling. We are not opening our city pool this year. So, there are definitely some hard changes being made to make up for those shortfalls.
The bad thing about this is we went from the mountaintop to this valley because
isn't that the truth?
Our numbers were looking good in cities across the state. We had all of this excitement, specifically at 2 college towns with new coaches. All of this building, and this virus had to screw everything up.
I know. Sometimes you just don't see it coming, but that's the only reason people do these jobs, right?
What lawyer do we find to sue the virus?
That's right. I'm in. Let me know.
You got it. Class action. Thank you, ma'am. Appreciate it very much.
Thanks, Paul. Have a great day.
You got it. Robyn Tannehill, the mayor of Oxford.